I want to thank the Alliance for Health Promotion for the kind invitation to share with you how the cooperatives that make up the Espriu Foundation have done and continue to do to face the COVID-19 pandemic, and the actions taken to reduce its impact on health equity. I also want to show my appreciation to Health Nexus for their support to carry out this 10th Global Health Forum that under normal conditions should have been held in Ottawa. Within these days, the global recorded cases of COVID-19 may surpass 40 million. The world saw its official COVID-19 death toll break the 1 million barrier. These figures are higher than the annually recorded from other infectious diseases such as malaria, tuberculosis, and HIV, which have been long time the world's biggest killers. According to the WHO data, Spain is among the 10 countries that count both more confirmed cases and fatalities. Since late January, when the first patient was diagnosed, uh, cases have been trending upwards. Since mid-March until the end of May, the government implemented a strict lockdown to control the spread of the virus. At the peak of the infection, there were more than 900 deaths daily, intensive care wards filled up quickly, and some hospitals were in the verge of collapse. In late May and June, the situation got somewhat better, and the daily number of infected cases reduced. Unfortunately, since mid-July, figures are growing again. So far, they have been more than 770,000 confirmed cases. Some 150,000 has been admitted in hospitals, more than 13,000 have needed intensive care, and regretfully near 32,000 patients have died. We should not forget that beyond those figures there are people, so they represent a lot of suffering. We at Espriu keep working hard every day to care for our community and our members. Before getting down to the experience of Espriu in tackling the pandemic, I want to share with you a few details about the organization. Espriu Foundation is a network of health cooperatives, hospitals, medical centers, insurance companies, diagnostic units, technology companies, etc., caring for 2.6 million people in Spain. Past year, we registered 30 million consultations, 419,000 surgeries, 540,000 emergency services. The whole group brought together more than 180,000 cooperators, directly employed more than 6,000 people, and achieved a turnover of 1.6 billion euros. Espriu offers complete health services to their customers and members in 16 hospitals all around Spain, 32 multi-specialty medical centers, and in partnership with more than 45,000 health professionals. Over more than 60 years, Espriu's cooperatives have developed a non-profit health model based on the reinvestment of any surplus in knowledge, technology, and infrastructure to improve the healthcare quality. We have consolidated a strong public-private partnership with the national health system and also developed a governance model for multi-stakeholders cooperatives, where doctors and patients share the decision-making process. The unprecedented health emergency we faced over the past months has compelled Espriu cooperatives to completely reorganize their healthcare services to be able to treat more than 12,000 COVID-19 patients. Once again, the cooperative model demonstrated its resilience. Thanks to the professionalism and commitment of the healthcare workers and all cooperative members and employees, we were able to handle the crisis. All the actions developed by Espriu have been implemented following the guidelines issued by the World Health Organization and the Spanish health authorities. Since the very beginning, we have been cooperating at all levels with the public health system. Thousands of COVID-19 patients have been admitted in the cooperative hospitals, where at the early stage of the pandemics, they had the priority because all non-urgent interventions were postponed. Medical consultation became virtual, and we launched a new system of telemedicine and remotely delivered healthcare. Hospitals restructure their facilities and protocols, increasing their capacity in place. They create new intensive care units with a several-fold increase in some cases and reassign professionals and tasks. Regarding employment, Espriu cooperatives prove resilient and choose not to make any workforce reductions, and facilitated to non-health workers staff switching to remote working as insurance their health and safety become a priority. Currently, more than 70% of non-healthcare workers can work from home, and at the hardest days of the pandemic, they were up to the 90%. In the healthcare area, additional medical and nursing staff have been taken on to meet the increasing demand. Health professionals of hospitals where the situation was not too hard went to help other centers overwhelmed by increasing admission of COVID-19 patients, sometimes in cities long away from their home. Even some retired doctors came back to lend a helping hand. It's note that the people are the worthiest set of social-economic enterprises. At the Espriu cooperatives, they were the main driving force behind the fight against COVID-19. We will never appreciate their unconditional commitment and professionalism enough. Paradoxically, many medical doctors have seen their practice close several weeks because of the lockdown. They have been unable to generate income to pay workers and bills. Espriu's cooperative launched an aid program aimed at help doctors to handle these financial issues. The concern for the community is one of the central values of Espriu. In that sense, we create a specific free telephone advice service addressed to all citizens. A team of the organization healthcare professionals, most of them voluntarily, provide guidance and clear coronavirus queries. To help people to cope with the lockdowns, we launched the website called Ahora más que nunca tranquilidad.es, meaning keep calm now more than ever. It compiles helpful content concerning exercise, nutrition, mental health, sleep, and working from home, backed up by health professionals. Cooperatives also set up flexibility plans, allowing clients and users affected by unemployment or income cuts as a result of the economic effects of COVID-19 to postpone the monthly payments. Doctors, nurses, and all health workers were in the front line in the hardest situations. They were working many hours under psychological strain to combat the coronavirus. Unfortunately, some of them have been affected by the disease. The cooperative launched a psychological support program helping professionals to provide them with the tools to manage the emotional stress generated by the emergency and protect their mental strength. Espriu cooperatives also joined forces with other Spanish firms to protect healthcare workers combating coronavirus by contributing to a solidarity fund set up at the insurance sector to cover them and their families. And which are the lessons learned from the pandemic? From my point of view, probably it's too early to get conclusions. It might be best to deep analyze this health crisis when a little time has passed. However, after several months struggling with the pandemic, we have some conclusions. The COVID-19 pandemic has magnified the persistent vulnerabilities and inequalities of our healthcare systems. Although governments have put a wide range of policies in place to combat the pandemic impact of public health, the scale of the challenge requires more. The joint and coordinated participation of all health resources, whether public or private, is vital. Now more than ever, we need a concerted effort by all actors in the health sector. Health cooperatives are a useful complement to health systems. In some countries, they even take the place of the national health system. Many times they fill gaps that otherwise would have been unattended. Therefore, cooperatives are a great ally of governments to develop health systems and improve access to health care of the citizens. Another key takeaway from the pandemic is that professionals are the wealthiest asset of the healthcare sectors. As the so-called second wave approaches and the healthcare demand increases again, the lack of well-trained and motivated healthcare workers become an evidence. Improvements in healthcare provision often can be reached if resources are pooled and health professionals enjoy better working conditions. Since many years, health cooperatives demonstrated their preparedness to combining workers' skills and financial resources to bridge the gaps in the provision of healthcare services. Finally, I want to mention digital technologies. Telemedicine, already undergoing rapid growth, has quickly become a key tool for both preliminary COVID-19 screening and also for non-urgent care and consultations. Health professionals also have taken advantage of digital communication tools to quickly share information on how to deal with the COVID-19 patients. Some of the developments that would have taken years to be implemented are already working, as the coronavirus emergency has been a catalyst that has pushed them up. Last but not least, we should learn to avoid making policy in times of pandemic and leave the management of this kind of situation to the experts. We will likely reach better results. Thank you very much, and that's all. If you want to have something to say, I will be waiting.